All right, so I'll go ahead and get started with the intros. People will continue to file in. So welcome, first of all. My name is Lauren Jones. I use she, her pronouns, and I want to welcome you all to Justice and Public Health. I'm the director of diversity, equity, and inclusion at the School of Public Health. I almost said DEI, but I have to remember not to do the acronym thing. So before we begin, I want to first acknowledge that the School of Public Health at the University of Minnesota Twin Cities is built on the traditional homelands of the Dakota people. Minnesota comes from the Dakota name for this region, which loosely translates to the land where the waters reflect the skies. We'll share some concrete resources for supporting our Indigenous relatives in the chat. I also want to point out that closed captioning is available for this event. You can access that by using the icon in the bottom right corner of your screen. You can also reach out to Sarah Harris, who's providing our tech support today, via the chat to ask questions about accessibility. We'll monitor the chat for questions as well as share links to our evaluation and information for future events if we have any. The Justice and Public Health series was started in 2021 as part of the School of Public Health's commitment to justice and anti-racism. We have been hosting monthly events with local and national experts around the topics of public health. The speakers and presentations in this series help to ground us in theory and in practice, as well as complement the classroom learning that our students experience. We also hope that today's discussion is part of a broader change happening outside of the School of Public Health. If you're interested in staying abreast of other events such as this one, please be sure to fill out our event evaluation after this and check the box to receive notifications about upcoming events. You can also visit our website at any time. This event will be recorded and we'll also share the slides from today. So I'm going to go ahead and welcome our speaker for today. Deja Wall is a dedicated environmental justice advocate for over 5 years of experience, with over 5 years of experience in environmental policy, community engagement, and sustainable development. She currently serves as Director of Programs and Impact at Clean Air North Carolina, where she leads statewide strategies advancing clean air, climate justice, and community-driven solutions. Previously, Deja served as Clean Air North Carolina's first environmental justice program manager and later as community science program manager, expanding localized air monitoring efforts across North Carolina. Her work centers on partnering with frontline communities to co-develop solutions, inform policy, and build capacity through real-time air quality data. Deja is an appointed member of the Governor's Environmental Justice Advisory Council and focuses on bridging science, advocacy, and justice to address environmental health disparities. She holds a Master of Science in Environmental Policy from Johns Hopkins, a Bachelor of Science in Sustainable Development from Appalachian State, and a Graduate Certificate in Geographic Information Sciences from UNC Charlotte. Please welcome Ms. Deja Wall.
Thank you, Lauren, and thank you everyone so much for your time today. If you'll just give me a second, I'm going to share my screen. All right, so Lauren gave a really, really beautiful intro, but just to reiterate, my name is Deja Wall. I am a director at Clean Air NC, and I've spent the last 8 years working alongside communities in North Carolina who are living with the daily reality of multiple pollution sources stacked on top of each other, what we call cumulative impacts. And that's what we're going to talk about today. And I have to tell you, I've never seen a moment quite like this one with major changes happening at the federal level. Things are happening on the hour, it feels like. And so state leadership on environmental justice and environmental issues have never been more critical. Today I just want to talk about how we move beyond one pollutant at a time and start seeing the full picture of community burden. And that's something that Minnesota is actually pioneering right now with your 2023 cumulative impacts law. So we'll get into that later, but first, I want to give you guys a little lay of the land and what we'll go over today and cover in our time. So first, I want to make sure we are all on the same page about what cumulative impacts really is and what it means and why it's so critical for public health equity. Then we'll dive a little bit into Minnesota's landscape because many of you may be even working or interested on the implementation of Minnesota's pioneering cumulative impacts law. We'll also look at success stories from states like California, New Jersey, Washington, and Chicago, because there really is a lot that we can learn from places that have been doing this work for years. And finally, I'll share what we're doing in North Carolina through the governor's EJ Advisory Council, including our recommendations for building a statewide cumulative impacts framework. So, the key takeaway that I really want you to leave with today is this: cumulative impacts frameworks move us beyond traditional single pollutant approaches to better reflect the lived experience of environmental justice communities. But before we dive in, let me share a little bit about my background and why this work matters to me. So, I came to environmental justice through an interdisciplinary path. Lauren already went over my educational background that's listed here, but I will say the most formative experiences for me haven't been in classrooms. They've been in communities across North Carolina with that are living with this daily lived reality of environmental harm. So at Clean Air, I've had the opportunity to build this work from the ground up. Like Lauren mentioned, I was the first environmental justice program manager, really establishing the foundation of our EJ work. I then moved into leading our community science program, which is our program that focuses on deploying low-cost air sensors in impacted communities. And when I started in that role, we had about 5 sensors in impacted communities, and now we have over 130. So those aren't just data points; those are residents that we have built trust with, who are collecting information about the air that they breathe in their own neighborhood, and then use that data to advocate for change. And then today, I got promoted back in May of last year as the director of programs and impact. So now I lead the strategy and implementation across all 5 of our program areas, not just environmental justice and community science, but also health advocacy and education. And then beyond Clean Air, I serve on the Governor's Environmental Justice Advisory Council, and specifically I sit on the Cumulative Impacts and Mapping Subcommittee, where I'm helping to shape the first cumulative impacts framework for the state of North Carolina. And then from a national perspective on this work, last September, I had the honor of being able to attend the Cumulative Impacts Workshop for Advocates in New York City during New York Climate Week. And that brought together leaders from 14 states, and it really reminded me how much we share. We share the same challenges, with single pollutant permitting. We share the same frustrations, and we share the same hope around cumulative impacts frameworks and policies that can finally give our communities the protection that they serve. So if you are working on these issues yourself, I just thank you for the care you bring to it. And if this is your first time ever hearing about cumulative impacts, I hope that I can inspire you today. So let's start with the basics. What do we mean when we talk about cumulative impacts? So in North Carolina, Executive Order 292, and I'm directly reading here, defines cumulative impacts as the totality of exposure to combinations of chemicals and non-chemical stressors and their effects on human health, well-being, and the quality of life outcomes. I know that's a mouthful, so let me break it down. When we talk about cumulative impacts, we're talking about the interconnected category of stressors. So first you have chemical stressors, and those are things we typically think about when we think about environmental pollution. So air pollution like PM 2.5, ozone, diesel particulate matter, water contamination from things like PFAS and lead, toxic waste facilities, hazardous waste facilities, things of that nature. But this is the thing, and this is really critical, is that chemical stressors, as you can see, are only a part of the picture. So we also have to look at non-chemical stressors. So those are things like poverty and unemployment, food insecurity when people live in food deserts, housing instability, lack of access to healthcare, limited educational attainment. These are social and economic factors that don't just exist alongside environmental pollution. They interact with it in ways that make health outcomes much worse. And then you have environmental conditions, so things such as extreme heat, flooding, hurricane exposure, wildfire smoke. Climate change is making these stressors more frequent and more intense, and communities that are already overburdened are being hit the hardest. And then finally, we talk about structural factors. So these are things like historical racism, redlining, zoning and land use decisions that concrete polluting facilities in certain neighborhoods, political marginalization that makes it harder for overburdened communities to have a say in decisions that affect their health. So the shift we're trying to make here is fundamental. So instead of asking, is this facility safe? What traditional permitting asks, what we're trying to shift to is this community already overburdened? Because if they are, adding another pollution source on top of all of these stressors, even one that meets individual safety standards can push them over the edge into serious health risks. So, speaking of health risks, you might be thinking, okay, this makes sense, this is intuitive, but where's the evidence? So, the research on cumulative impacts and health is actually quite compelling, staggering. There is a lot of research out there. I wanted to share some key findings, though. So, communities with multiple stressors experience worse health outcomes than exposure to any single stressor alone. So, it's not additive, it multiplies. So the combined effect is greater than the sum of individual impacts. So, for example, in California, Latino neighborhoods experience 2.7 times more diesel particulate matter and 1.3 times more PM 2.5 than non-Latino white neighborhoods. And this is according to 2021 data from the UCLA Latino Policy and Politics Institute analysis. And we're seeing the health consequences of that. So higher rates of asthma, lung cancer, heart disease, as well as, emergency department visits for asthma rate at twice the rate in these communities. There's also a lot of fascinating research on urban adolescents with cumulative impact stress. So when you layer poverty, neighborhood stress, and school stress all together, these kids have significantly worse asthma control and more emergency visits. So a 2024 study by the Journal of Pediatric Psychology found that cumulative risk was significantly associated with worse asthma control and more ED visits. And that cumulative risk index was actually a more robust predictor of health outcomes than any other individual stressor alone. So the key insight here is that cumulative risk is a more predictive or more of a predictor of health outcomes than any individual factor. So single pollutant assessments, which is currently how we operate, really miss the full picture of community health burdens. And you can see this visually here in this chart on the right. When you look at single stressors, the relative risk might be 1.2 or 1.4, but when you look at multiple stressors combined, you're seeing the relative risks of 2.5, 2.8, or even higher. And that's not a small difference. That's the difference between manageable health challenges and chronic lifetime conditions. And the biological pathways are well documented too. So chronic stress, it dysregulates the immune system. It impacts inflammatory responses. It affects health behaviors and disease management, mental health challenges, which is something we don't really talk about a lot. But this, people that are living in and around facilities, they're smelling things all the time. They're experiencing headaches, dizziness, maybe all of the time. This really, really affects your quality of life and eventually your mental health. So this isn't theoretical. These are stories that I hear, almost daily, and this is happening in communities across the entire country every single day. So if the science is clear and we know what's happening, we know people are being affected, why are we still doing things the old way? This is the question I ask myself almost every day. When I have the answer, I'll let you know. But the problem is that traditional permitting approaches, they were never designed to account for all of this stuff. They were never designed to account for cumulative impacts. So here's how it typically works. So each facility gets permitted individually. So regulators look at a specific facility and whether it meets emission standards. So whether it's like a safe level of pollution on its own, but they don't account for the existing pollution burdens in the surrounding community. So communities near multiple facilities end up bearing a cumulative burden that was never assessed, often without their knowledge or consent. I talked a little bit about zoning, but some of these communities are zoned in industrial areas, and when that's the case, at least in North Carolina, sometimes these facilities don't even need to notify them that they're being cited. And here's the kicker. So if every polluter in an area is emitting up to what is considered safe, a safe limit, the collective emissions are often still exceeding the safe thresholds by significant margins. So I just made a visual here just so you can see what that looks like in reality. So just as an example, we have 3 facilities in a community. Facility A is emitting at 40% of the safety threshold, it's approved. Facility B is 35% approved. Facility C at 45%, it's approved. But when you add them up, the cumulative exposure is 120% over the safety threshold. That's dangerous. That's exceeding what any regulator would consider safe. But under traditional approaches, each facility was permitted individually and no one looked at the cumulative picture. The result of this is EJ communities become what we call sacrifice zones. And this is a term coined by EJ advocates to describe areas where multiple polluting facilities concentrate in disadvantaged communities, creating disproportionate exposure and worsening health disparities over time. So for a real world example, we can point to areas like Sampson County, which is where I do a lot of work here in North Carolina. We actually have a grant out in Sampson County, but this is a community where 54% of the population is Black, Indigenous, people of color. That's home to over 2 million swine in concentrated feeding animal operations. That's not even mentioning poultry. A major county landfill, which was found to emit some of the worst toxic releases than anywhere else in the country. And a large wood pellet facility. So each of these sources were deemed acceptable on its own. There are probably hundreds of thousands of CAFOs in Eastern North Carolina. And none of these are being addressed individually. Or sorry, all of these are being addressed individually and not together. But when you combine the PM 2.5, the hydrogen burden, all of these things, it creates these health effects. So this was actually documented by Duke University researchers. They found that Sampson County had higher rates of infant mortality, kidney disease, and hospital admissions. And that's the reality of cumulative impacts. No single permit accounted for the total harm, but residents are breathing in this cumulative cocktail every single day. So now that we talked a little bit about the negative, let's talk about the positive and what's actually being done to address this. And I wanted to start with Minnesota because we're at the University of Minnesota. And this really is where rubber meets road. So in 2023, Minnesota passed a cumulative impacts law. And this is pioneering work. So it's the first cumulative impacts legislation in the Midwest, which is really, really impressive. So props to you guys. But what does it actually do? So there's 3 things that it does. It requires the Minnesota Pollution Control Agency, the MPCA, to consider cumulative impacts during air permit decisions for new and expanded facilities. Second, it applies to facilities in or near environmental justice areas in the 7-county metro area, plus Duluth and Rochester. And then third, it mandates community benefits agreements, which is a huge one, when substantial adverse cumulative impacts are identified. So again, this is huge. It's not just about analyzing impacts, it's about requiring remedies when communities are already overburdened. Now, how does this law define an environmental justice area? This is something that we come across all of the time when we're talking about cumulative impacts, when we're talking about environmental justice in general. Having a definition for what what you define as environmental justice for your community is really, really important. And that's something that you'll notice across all of these examples today, is that's a pretty, standalone, that's a primary process of cumulative impacts, is defining your community and what environmental justice looks like. So in Minnesota, a census tract qualifies if it meets any of these criteria. So 40% or more of the population is non-white, or 35% or more of households have income at or below 200% of the federal poverty level, or 40% of the population over age 5 has limited English proficiency, or it's located within Indian country. So the current status of the MPCA is conducting rulemaking right now, actually. So draft rules are due by May 2026, as is required by the Minnesota statute section 116.065. So we, all of us, but mostly you guys in Minnesota are in a very critical window where the details of implementation are being worked out. And that's where community engagement becomes absolutely essential. So a little bit more about how Minnesota's process works. So I kind of want to walk through this step by step. So step one is determination. So the MPCA commissioner determines whether a proposed permit may substantially impact an EJ area. There are benchmarks for requiring cumulative impacts analysis, and importantly, communities can petition for analysis if they gather 100 or more residents. So I really love that part of this law. Because oftentimes, we're in North Carolina, I probably sign a petition every day, and I don't know if it's actually doing anything. So it's really cool to see that, there's a cap, there's a petition number that can be reached to actually trigger action here. And then step two is analysis. So if analysis is required, the facility conducts a cumulative impacts assessment. So they examine past and current pollution burdens, assess environmental stressors in the community, and consider socioeconomic factors. Step three is then public engagement. So this is where Minnesota's law is really strong. So there have been at least two public meetings. There has to be at least two public meetings in the impacted EJ area. The first meeting has to happen before the analysis is conducted, and then the second meeting happens after the analysis is completed. And then there's a 30-day advance notice, and materials have to be translated. And then the fourth and final step is the decision. So the commissioner considers both the analysis and the public input. They can deny the permit, or they can require a community benefit agreement. And so community benefit agreement, I don't think I put a description here, but it's basically an agreement between a community and an entity where, just as an example, if an entity gets a permit and they decide to expand X amount of acres, however many acres they expand, they have to give a certain, they have to plant a certain amount of trees or something in the community. So community benefits agreements kind of lay out those trigger points and what an industry can give back to the community if they are, polluting in their area. So I want to be honest, though, about the gaps here. It's really important to recognize the gaps in these laws. So the first one is that the 2023 law does not apply to highway and transportation projects. That's a significant gap because, you guys, just like many other states, you guys have major highways like I-94 and I-35. Which have historically divided and polluted EJ communities. There is a proposed legislation that would extend cumulative impacts analysis to the Minnesota DOT projects, and that's something worth advocating for. Just wanted to point that out. Again, really, really encourage you guys. May 2026 is the deadline on making these changes. So there's community engagement processes happening around you. I really, really, really encourage you to get involved. But here's what gives me hope. So focusing more on the opportunity side, Minnesota has a strong community organizing foundation from what I've seen from my research. So groups like the Minnesota EJ Table, COPAL, and CMEJ have been doing this work for years. And Minnesota can really learn from other states' implementation experiences. And that's what we're going to talk about next. So this is one of my favorite cumulative impacts tools. I don't know if we have any reps from Cal Enviro Screen here today, but you guys do Great work. So yeah, I want to turn us to places that have been doing this work for a while. So that is California, and California's, or it's called Cal EnviroScreen, and it really is the gold standard. It's been operating for over 10 years, and it was developed by the California Office of Environmental Health Hazard Assessment. So CalEnviroScreen is a science-based mapping tool that ranks 8,000 plus census tracts in California using 21 indicators across pollution burden and population vulnerability. So the tool has four main components. So exposures like ozone, PM2.5, air toxics, etc. Environmental effects like cleanup sites, brownfield sites, hazardous waste. It also covers sensitive populations, so that's tracked through things like health data, or tracked through health data like asthma, heart disease rates, et cetera. And then socioeconomic factors is the last component. So that's things, again, like poverty, unemployment, and education levels. So how is it actually used? It identifies, again, back to this definition of how we identify EJ and disadvantaged communities is a big one, just pointing that out again. But it identifies disadvantaged communities that receive dedicated funding dedicated funding streams, including 25% of California's cap and trade auction proceeds under Senate Bill 535. And that translates to over $4 billion invested in these areas since 2014 through programs like the Community Air Grants, which provide seed funding for local air monitoring and emissions reductions projects in the most impacted neighborhoods. The tool also guides agency resource allocation across Cal EPA's board and departments. So from the Department of Toxic Substances Control, using it to prioritize contaminated site cleanups, or to Cal Recycle, using it to target illegal dumping enforcement in the highest burden census tracts. So it does a lot. It also informs policy decisions. So it informs the Environmental Justice Task Force decisions by providing the data foundation for enforcement priorities, permit reviews, and even siting decisions for new facilities. Essentially, it's creating like a check before agency actually approved projects. And then crucially, community groups use it to understand what's happening in their own neighborhood. So organizations like the California Environmental Justice Alliance and local groups in the Imperial Valley or Richmond have used EnviroScreen rankings to advocate for specific buffer zones between schools and industrial facilities, to demand truck electrification routes, and to challenge permits that without data is hard showing. So they were just showing that this is the burden that their community already carries, and they used CalEnviroScreen to do that. So with all of this in mind, three lessons that we can take from California is: first, regular updates matter. They are now in version 4 and drafting version 5 of this. So that's really incredible. Regular updates, keep the data relevant, and, just build community trust that you're hearing and you're shifting, as our communities shift and as things change for us. And then the second is you need both rigorous science and community input. So CalEnviroScreen combines the scientific methodology with the community validation. And then third, real resources have to flow. They have to. Identified communities receive actual funding and program investments, not just recognition on a map. So this isn't just a mapping exercise or a tool. It's literally directing billions of dollars and determining which neighborhoods get cleaned up first. So that's the difference between having a cumulative impacts tool and actually using it to shift power and resources. So good job, California. Okay, so the next one I wanted to talk about is New Jersey. So this is actually our nation's first cumulative impacts permitting law. So that was passed in 2020 with regulations adopted in April of 2023. So this was really, really groundbreaking. The law requires cumulative impacts analysis for 8 types of facilities listed here. So that's major air pollution sources, landfills, scrap metal facilities, solid waste facilities, incinerators, sewage treatment plants, medical waste incinerators, and large recycling facilities. And here's what the facilities actually have to do. So they have to submit an EJ impact statement documenting adverse cumulative stressors in the community. There has to be a public hearing in the affected community with meaningful engagement. There is a written public comment period. The New Jersey Department of Environmental Protection evaluates disproportionate impacts and can deny permits if the project doesn't serve compelling public interest. And then the permit conditions must avoid or minimize stressors when possible. So again, that definition, how do we define an overburdened community? New Jersey defines it as a census block meeting any of these criteria. So 35% or more low income households, 40% or more racial and ethnic minority residents, or 40% or more limited English proficiency. So what made this work? First, there was a sustained relationship between the state agency and the community coalition, which is the New Jersey Environmental Justice Alliance. Community advocates actually proposed the cumulative impacts focus back in the early 2000s, and the EJ Advisory Council, their cumulative impact subcommittee, laid the years of groundwork. And then this just shows that there was sustained organizing and coalition building across sectors, and it was truly a team effort. But I will say one challenge that they faced was that neighborhoods falling in and out of EJ community status due to changing demographics during the permit review is just something to watch out for in implementation. We have to have this solid definition. Okay, so two more quick examples before I move on to North Carolina. Washington State passed the HEAL Act, which creates a comprehensive framework for environmental justice across all state agencies. So it defines EJ in state law with an explicit racial justice lens. It directs funding towards highly impacted communities. It ensures tribal sovereignty as part of environmental justice. It creates an environmental justice council and an office of the environmental justice advocate, and it funds and applies the environmental health disparities map. So the Front and Centered Coalition leads this implementation work with community members on the HEAL working group guiding priorities. So there's ongoing accountability through the council, reporting directly to the governor, and that's very similar to North Carolina and what we do here. So Chicago, moving on to Chicago, they just passed the Hazel-Johnson Cumulative Impacts Ordinance in 2025 last year. It's named after Hazel M. Johnson, who many consider the mother of environmental justice. She founded People of Community Recovery and at Geld Gardens and spent decades exposing what she called toxic donut of pollution surrounding her community. So the Chicago Ordinance codifies an EJ definition into city law. Just pointing it out again, definition, EJ, how you define your community, very important. It requires citywide cumulative impacts assessments every 5 years. It creates an environmental justice advisory board with community representation, and it removes by right zoning for intensive manufacturing, recycling, and warehousing. Meeting those developments now have to go through a more rigorous review process with community input. Some of you may remember I mentioned maybe a few minutes ago that some of these communities that are zoned industrial, sometimes, at least here in North Carolina, they don't have to go through that intense process that other permit facilities may have to go through. So it was the same in Chicago, and this law now requires even those areas and industry areas have to go through this rigorous review process like every other permit. All right. So, kind of bringing everything together, what do all of these successful frameworks have in common? 5 key elements, and I want to start with the most important one, and that's community-led process. Frontline communities need to help shape policy design. There has to be ongoing engagement, not just a one-time input type thing. And there has to be community representation on advisory bodies. You may have noticed a lot of these either laws or frameworks, they have these advisory bodies around them. North Carolina is the same. And so it's really imperative that we have representatives from communities serving on those boards, bodies, councils, etc. The second is that science-based, we have to have science-based tools. So multiple indicators covering both chemical and non-chemical stressors, like I discussed at the height of the presentation, regular updates and improvements like Cal EnviroScreen is doing, transparent methodology, and publicly accessible data. That's a big one. Data access, data justice is a huge, consideration when we're talking about cumulative impacts and just environmental justice in general. And then the third element of a successful framework is clear definitions. You need to have clear criteria for environmental justice or overburden. I know I've said this a million times, but just to reiterate that, cumulative impacts have to be clearly defined, and covered facilities and processes need to be specified. There cannot be gray areas around how we define our communities, around how we take action around these things. And then fourth is it has to be integrated into decision making. So this is critical. So that way it moves us beyond, just data collection or data outputs. So the framework has to actually affect permits. It has to affect zoning and resource allocation. There needs to be clear triggers for when analysis was required, meaningful public engagement requirements, and just enforcement mechanisms. All of these things, need to be baked in and incorporated. And then fifth is accountability structures. So advisory councils, like I mentioned, a lot of these other groups, a lot of these efforts that are going on have advisory structures. So I believe that this is needed for success, but the winning formula is bringing all of this stuff together. So rigorous science plus community leadership plus clear implementation pathways plus accountability mechanisms. Successful frameworks don't just identify the problems, they drive resources and they drive solutions towards they drive decisions towards solutions. So we really have to focus on combining all of these things for a winning formula. Okay, now I'm bringing it back home before I end us out to North Carolina, where I've been doing this work. So in 2024, Governor Cooper signed Executive Order 292, which established North Carolina's commitment to environmental justice and defined cumulative impacts for state government. So it created the Environmental Justice Advisory Council with subcommittees, including the Cumulative Impact Subcommittee that I serve on. Prior to that, I served on the mapping subcommittee where I worked with DIT to help build our first ever statewide EJ tool. And we have since combined the mapping subcommittee and the cumulative impact subcommittee. So those two are now together. So why this matters in North Carolina, the data is pretty stark. So census blocks with more than 50% Black, Indigenous, Latino or AAPI populations are 2.8 times more likely to have waste facilities. And this is according to a 2003 statewide analysis published in Environmental Health Perspectives. Low-income households are 1.5 times more likely to have waste facilities in their neighborhoods. Regarding child poverty, 16.2% of North Carolina's children lived in poverty in 2024. That is over 374,000 children, with the state ranking 15th highest in the nation for child poverty rates. And when we look at broader economic insecurity, 40% of children in our state live in poor or low income households. And then from an air quality perspective, Charlotte received an F and a D ratings for air quality in all of these years listed here. We actually reported our first year with no bad air quality days for the first time last year. Not discounting the work of Charlotte Mecklenburg. Charlotte Mecklenburg Air Quality does incredible work. It's just, a reality that we have to face. Air quality is a huge concern in North Carolina. From a historical context and perspective, This isn't accidental. Like many southern cities and states, this is the result of decades of systemic policies like redlining, discriminatory zoning, racial gerrymandering, all of these things that confined low-income communities and communities of color in these high-risk areas. So according to the 2024 State of Exclusion Report from the North Carolina Fair Housing Project, residents of majority Black clusters are nearly twice as likely to live within 1 mile of a solid waste facility compared to the state average. So when you think about all of these things and you look at the compounded exposure in North Carolina communities, such as substandard housing, food deserts, water contamination from the PFAS and lead, the lack of access to healthcare, the air pollution issues. There's a huge digital divide as well in North Carolina. So, lack of access to internet, Wi-Fi, access to information. All of this stuff, you're seeing cumulative impacts in action. And the health outcomes follow that after, such as asthma, low birth rate, lead poisoning, chronic diseases. We're having a pretty high occurrence of baby blue syndrome as well in Eastern North Carolina due to high nitrate and well water. So again, there's many health issues in North Carolina that definitely require us to address this. So what are we doing about it? So the Environmental Justice Advisory Council, I mentioned the Cumulative Impact Subcommittee. We met throughout 2025 developing recommendations for North Carolina's framework. Our subcommittee is chaired by Sherry White Williamson, who is an incredible environmental justice leader and voice here in North Carolina. And our members include Jeff Hart, Javita Lee, Marilyn Marsh Robinson, Naima Muhammad, who is also a very long-standing mother of environmental justice, if you will. Myself and Dr. Rebecca Witter, who actually, I didn't personally have her when I went to App State, but she's a professor at App State. And then we also get support from Will Hendrick, who is the director of environmental justice at North Carolina Conservation Network. And then Andrew Geller, who supports us as well. He's a senior science advisor at the EPA Office of Research and Development, or was, RIP ORD. And then Jasmine Washington, who is a senior attorney at Southern Environmental Law Center. So we all work together to do all of these things. And this year, or last year, rather, we had bi-monthly meetings developing recommendations. We had a discussion with Christy Ellerson, Dr. Christy Ellerson, excuse me, from the Union of Concerned Scientists, who has been leading instructional and technical cumulative impacts work for quite some time. And we've been conducting, legal and indicator research reviews. And through this work, we've identified 3 promising practices for North Carolina. So practice 1 is build community academic partnerships for data collection, analysis, and storage. This means supporting community-based participatory research. I mentioned I work for Clean Air. We have over 350 sensors out in the state. So we are really encouraging the use. A lot of residents are testing wells, things of that nature. And so we are really encouraging, the use of either partnerships or supporting, this community-based participatory research. That also includes training community members in data collection, making findings accessible and understandable, and ground truthing data with lived experience. Our second practice is partnering with the Department of Information Technology to create and house a cumulative impacts index. So the DIT would provide the technical backbone and housing, while a university community partnership will drive the scientific design. And there's a lot of reasons for this. My organization, Clean Air, we operate our own dashboard, and we see layers being stripped. At first it was happening a lot last year. It slowed down a little bit, but there's a lot of layers that are no longer accessible on our dashboard because they came from the federal level, and federal data is just disappearing left and right. So because of that, we really need to lean on our university partnerships to help us, either create indexes, identify these layers, et cetera, to have that, scientific design behind us. And then practice 3 is to design methodologies that capture layered real life conditions. So that means both chemical and non-chemical stressors, accounting for factors that accumulate over time and reflecting community priorities and concerns. And we are almost done here, so thanks for sticking it out with me. But these are the recommended data categories for North Carolina. I won't go through every single one of these. But we want to look at social vulnerability, things like low wealth, poverty, heat, health vulnerability, so life expectancy, asthma prevalence, pollution exposure, climate vulnerability, extreme heat, extreme flooding. We just had Hurricane Helene hit last year, and completely wipe out some towns in North Carolina. So, that's a climate vulnerability is hitting us very hard here in North Carolina, and we really need to focus on those categories to ensure that we're being proactive and not reactive when these things are hitting. And then finally, political vulnerability. So this one does not get enough attention, but power and influence in the decision-making process, access to information, voting rights and participation. They just got rid of a voting site at an HBCU here in North Carolina. So voting rights and participation is a big one. Environmental monitoring, regulations and enforcements, and industry influence on politics, access to federal funds and oversight. These are all very heavy things that are very prevalent in North Carolina, especially the industry, influence on politics. And there are NC, North Carolina specific needs that we have to account for. So that's private wells data. I mentioned baby blue syndrome that's coming from high nitrate in wells. So we have to have private wells data, which is widespread in rural North Carolina. Poultry and agricultural facilities are a major industry here. Hogs outnumber the amount of people in North Carolina. And then additional social determinants of health and structural racism indicators. We are in the South, after all. So for our methodology and how we're going to move forward, our subcommittee is recommending that we follow the CDC Environmental Justice Index as the foundation for North Carolina's framework. So why CDC EJI? So first, it already incorporates a cumulative impacts framework, so we're not starting from scratch. Second, it uses census level track data for neighborhood scale analysis. Third, it combines environmental, social, and health factors into one integrated tool. And fourth, it is nationally comparable but adaptable to the state context. So the EJI has 4 modules, that's environmental burden, which covers pollution sources and exposure, social vulnerability, which covers demographic and economic factors, health vulnerability, which covers health outcomes and conditions, and then climate burden, which was added in 2024 with 9 additional indicators. But at this point, we need North Carolina specific adaptations. So like I mentioned, private wells, and then poultry and agricultural facilities. So wet poultry is regulated in North Carolina, but dry litter poultry operations are not regulated in North Carolina. And they make up majority of poultry operations. So we have a lot of state groups that are working in North Carolina, including ours, that are working to actually create, using community science, participatory research to create data sets around where these facilities actually are, and using like satellite data, AI, et cetera. So those are the types of data and layers. We would want to, again, work with groups, participatory type data that's collected, and university partnerships, and to, have that be a part of our process. But all of this has to be validated through community engagement. So the indicators, they have to reflect lived experience and the priorities of, North Carolina's diverse communities. So these are the 10 principles that our subcommittee developed for advancing cumulative impacts in North Carolina. So the first one is prioritizing cumulative impacts in pursuit of equitable access to a healthy, sustainable, and resilient environment. The second priority is focusing on preventing harm in overburdened communities. So shifting from reactive to proactive, like I mentioned. 3, centering impacted communities through engagement and knowledge co-production. So having them be a part of the process from start to finish. When we were developing the environmental justice tool that is now live, we had so many feedback sessions where not only virtually, but like in community. So like I mentioned before, it can't just be like this one-off kind of, well, what do you think? And then that's it. You know, community members have to feel like they're being actively centered in this process, and they have to be centered in this process in order for us for actually to be effective. So that leads me to the fourth point, which is it has to, you know, reflect real life circumstances and methodology design and capture lived experience. And that's why, you know, impacted community members need to be a part of this process. 5 is use lesson learned to improve understandings of EJ in multiple variables. 6, internalize indicators of inequity in the method. So make disparities, visible and actionable. And then 7, recognize that environmental justice is not just substitutable. Clean energy and jobs automatically address, don't automatically address environmental justice. 8, we have to ensure sustained data access through institutional partnerships for long-term maintenance. I touched on that a lot as well, but again, federal resources are disappearing. We have to lean on our university partners to really help us support sort of the scientific rigor methodology behind the scenes. 9, work from existing frameworks. Like I said, we want to use CDC EJI. And then 10, implement transparency measures and checkpoints for continuous improvements and accountability. We should be on version 5, 6, 7, like Cal Enviro Screen, you know, as we move through this process. So these principles, you know, they're not meant to guide just the technical development of a cumulative impacts index, but the entire process of how we engage communities, how we make decisions, and how we hold ourselves accountable. So challenges and opportunities in North Carolina, want to be completely transparent. Challenges, the political landscape. There has been a dilution of executive power. Very recently, there has been agency politicization and shifting political priorities that makes this work harder. Data gaps, we have limited state level data collection on key indicators, and we can't rely on federal data anymore. Resource constraints, we need sustained funding for implementation and community engagement. Community capacity, we completely recognize that residents are stretched thin already with their own burdens. They have limited time for engagement, even when they care deeply about these issues. So we have to get strategic about how we, you know, gather input and how we are also giving back to people for their time. So there's also real opportunities though. So from a positive perspective, you know, the EPA just released its interim framework on advancing considerations of cumulative impacts in 2024. I don't really know where that stands now with everything changing. However, you know, that guidance is still available, and it makes me hopeful that these things are eventually will move at the federal level. The National Academy has released a consensus report in 2025 on the state of science for cumulative impacts assessment. Our DIT, like I mentioned, we've already developed an EJ tool, so this gives us a foundation to build on. Another strong opportunity is that HBCUs are ready to collaborate on research and data collection and other MSIs and other universities. And then we also have a strong EJ movement across the state with active coalitions and advocates. This is just a shout out. I don't know if most people know this, but the environmental justice movement did start in North Carolina. So we have a very strong movement here. We have strong coalitions. We have strong groups that are working together on this, you know, day in and day out. And then finally, there's so much already moving across the state or across the nation, which I already went over. So we can learn from others about their examples moving forward, and make sure that we're creating a good tool for ourselves. So one of my last of 2 slides here. Thanks for sticking it out this long. But the key takeaways for everything that I discussed today, number 1, cumulative impacts are essential. So these frameworks are essential for addressing environmental justice. Single pollutant approaches fail, overburden communities greatly, and we must account for the totality of exposure to chemical and non-chemical stressors. Two, health impacts compound when chemical pollution intersects with social stressors like poverty, housing instability. All of these health disparities worsen exponentially. Not it's not an addition. Three, Minnesota is pioneering in the Midwest. So it's a very cool thing with its 2023 law. Again, it's currently in rulemaking. This is a really critical window for those of you that are living in Minnesota to get involved. Four, successful models exist. We went over all of them today. So that's, a really good key takeaway from today. Five, North Carolina is building its framework through our EJAC recommendations with a focus on community academic partnerships and the CDC EJI methodology. And six, community leadership is critical at every stage. So I want to close with this. I always like to close with a call to action. So for Minnesota advocates, again, I want to reiterate, engage in the MPCA rulemaking process if you can. Public comment periods are really critical. So push for the transportation, project inclusion. So like I mentioned, highways are major sources of air pollution, and these are currently being excluded. Not to mention highways were primary means of segregation, back in the day. So there's a lot of systemic, you're missing a lot of systemic issues by not addressing highway pollution and transportation. So yeah, with that too, share your community's cumulative impact stories. Your lived experience matters if you are an impacted community member. And then connect with the Minnesota EJ table, COPAL, and CMEJ. Join the movement in Minnesota. For researchers and practitioners, I just urge you to support community-based research, not just extractive studies. So develop locally relevant indicators. Context really matters. Create accessible data tools that make information usable for communities, and ground truth findings with community input to validate lived experience. And what I'll add to this as well is, universities oftentimes have a lot of the opportunity to actually apply for funding and go for these funding opportunities. So just being, like fiscal sponsors for community groups, or supporting community groups and writing proposals, things of that nature. That's a big way that I can see researchers and practitioners supporting. For policymakers, center community voices and decision-making processes. I don't know if there's any policy or decision makers here today, but fund sustained implementation, not just one-time investments. Build agency capacity for cumulative impacts analysis. We need infrastructure to be able to actually implement these things, because, for example, with us at the EJAC, we can make these recommendations all we want, but if state agencies aren't going to adopt it, then it's not all for naught, but it's just kind of sitting there as a data source and not an implementation, enforcement mechanism. And then across states, we can, share lessons learned. Peer-to-peer learning accelerates progress. I'm consistently wanting to meet with other advocates who are working on cumulative impacts across the nation. So if that's you, I would love to hear from you. I'd love to chat with you and see what you guys are doing. And yeah, just support peer-to-peer learning, advocates teaching advocates. Yeah, I would say that's a big thing. But one final reminder before I close out is just that cumulative impacts work requires persistence, patience across multiple legislative sessions. It requires readiness to seize opportunities and sustained capacity for community engagement. It's really long haul work, but it is so worth it. So yeah, again, like I said at the height of the presentation, I hope that I could inspire you today. And here's my contact information if anyone wants it, if you want to follow up with me. But I know we still have 30 minutes, so I can stop here for questions.
Thank you, Deja. That was so good. I learned a lot, even though this is not my area of expertise. I'm a resident and a citizen and a homeowner, and there's a a highway about a mile away from me. And so I think a lot about like, what is that doing to my well-being, right?
Mhm.
So there is a question in the chat. I'll read it for you and you can answer it. And then as you all have other questions, please put them in the chat. Deja will get to them. This is from Benita. It says that municipalities in North Carolina are undergoing updating the UDO. Upzoning is being pushed to create density primarily in unincorporated neighborhoods, which are primarily African American. How can these tools slash information be utilized to advocate for community protections?
That is a great question, Benita. And I actually work really, really closely with Benita, and I appreciate her being here today. So yeah, a lot of municipalities, like she mentioned, are undergoing updating the UDO. So I think there's a lot of things that we can do for the UDO, specifically drawing from a lot of the presentation materials. So for one, I feel like we can reframe upzoning as a cumulative impacts issue. So, before we add things like density, which brings traffic, construction dust, strain on aging infrastructure, we need to ask, is this community being overburdened? Again, we can insert cumulative impacts language into UDO text. So, I'm trying to think of as an example. But like this mirrors Minnesota's 2023 law, so requiring analysis before permitting, except here you're applying it to zoning entitlements. So for example, if we look at the NACs or if we look at index, if there's a specific tool that the UDO wants to address, they can say, like in census blocks or groups ranking 25% of the CDC EJ index for EJ burden, or where a community monitoring demonstrates existing pollutant levels exceeding 50% of the NAC standards. Increased density shall be prohibited unless accompanied by a community benefit agreement that mitigates, existing cumulative burdens. So I think these are the types of language that we can, push for in UDOs. But we can also, flip the script. So instead of developers analyzing impacts up after upzoning is approved, we can demand that municipalities conduct assessments before these amendments. But yeah, I hope that answers your question. And, Benita, I'm happy to talk to you more about this in depth.
Right. So the next question comes from Ming-Ching Lang. We talked a lot about the distribution of polluters. Are there any efforts about the distribution of resources that promote environmental health, e.g., parks?
Okay, yeah. I mean, I feel like this is where cumulative impacts frameworks gets really interesting. They're starting to not just measure the bad stuff, or we're measuring the bad stuff, but we also are missing the good stuff, like trees, tree canopy, parks, safe housing, cooling centers, etc. Yeah, I think some of these positive amenities of these distribution efforts are showing up in the work. So I mentioned California, the Enviro screen is a good example. So they measure environmental effects as assets. So this drives like greening California investments. I mentioned those cap and trade dollars specifically directed. Those are directed specifically to like plant trees and create parks in the same EJ communities. I mentioned the CDC EJI. They have like a built environment module, which specifically includes things like parks, walkability, housing age, redlining legacy. But yeah, there's definitely we can layer these, methodologies to essentially ensure that we are continuing to capture these real life lived conditions that includes, the good things that promote environmental health.
We have a nice message from Justin in the chat as well. Um, I don't see any other questions. So if y'all have questions, again, put them in the chat. But I have a question for you. I'm assuming that we have a couple of students, we usually do, in our audience. And so I'm just curious if you have advice for our students who are interested in working in environmental justice, in terms of funding, internships or externships or jobs. What advice would you give our upcoming graduates?
Yes. So, and I know that it probably feels very daunting right now with everything happening across the world. But I will say, I mean, there's so many resources out there that's available. Environmental justice is becoming, less of a buzzword and more of a thing that we're seeing, actually like practicing, and we're seeing jobs like specifically related to environmental justice. And because of COVID, a lot of things are remote as well, so you're not just limited to your area of practice. But I can just kind of walk through how I did it: internships, connections, join forums like this. If you see a speaker that resonates with you, reach out to them on LinkedIn. I can't tell you how many coffee dates I've had, how many one-on-one chats, like informal interviews. I did two this morning. Like, just reach out to these people, because it's all about connections. I know you've probably heard it's not what you know, it's who you know. Unfortunately, that's even true in the environmental space. You really need these connections to kind of open the doors sometimes. So yeah, just getting connected. There's a lot of great, well, I don't even know where AmeriCorps really stands, but I did AmeriCorps. And I will say that it provided me, the pay wasn't great, but it really propelled me. That was the best leadership experience I've ever had in my entire career. So, programs like AmeriCorps that are really focused on, investing back into community, are where you're going to either positively or negatively be hit with the reality of how to do this work. So yeah, just tap into your networks, internships. Yeah, you never know what could come up. But just generally, what I'm personally doing is you have to find time to take a step back as well, because you can't show up for community if you're not showing up for yourself. So just be sure to, consistently tap in to, where you are personally, and make sure that you're saving that space for yourself, to be able to ask those hard questions, if, to be prepared for this work.
100% agree. I would also say, like, at least in my experience, all of our fields are very small. And so do create, invest in, and maintain and cultivate those relationships with your cohort if you have it, or your classmates, because you just never know where folks will end up.
Absolutely. Yeah, and again, connections. If any students on this call want to reach out to me, I can re-put my email in the chat here. Um, but yeah, please reach out. I'd be happy to chat if you have any questions about your trajectory, any of that stuff. I can tell you, I started off in like conservation ecology. I wanted to work with animals. Now I'm like in policy, and I kind of want to go to law school. So I've done like a complete like 360. So definitely connect with folks and understand their path, and just know that your path is not, it doesn't have to be set in stone. You can build as you go.
Yeah, cool. I don't see any more questions, and I don't believe in like holding people just because. We did well, Sarah put the link to the evaluation in the chat if you scroll up a little bit, and so we would love to hear from you all about the effectiveness of these programs and events, and also how we can continue to improve our work. And we want to thank Deja for coming and spending time with us today. Please send some of that warm weather this way. We need all of it. We appreciate it. And we appreciate you again coming to talk to us. Everyone, you already know how to reach out to me and let me know what you want to hear more about, who you want to hear from, those sorts of things. I hope you all have a fantastic rest of your day. And Deja, thank you again.
Thank you. Everyone have a wonderful rest of your week.
Take care.